When you're working with people for 24 hours on end, you bond in a way that you probably won't with just other people outside of your job. Hi, my name is Yanire Connor, and I am an advanced EMT. I am originally from Boise, Idaho. I've been here now for 24 years, and I love what I do. Yeah, so I usually get to work around 7 a.m. Shift doesn't start typically until 7:30, but usually want to get there in case an early call goes out. And that's usually the time between 7 and 7:30 that we meet with the crew that we're relieving, and we talk about either calls they went on over the last 24 hours, any equipment they used, any supplies that we're going to be needing, as well as, the state of our rig, so our ambulance, if there's anything, if we're gonna have to trade out of our ambulance, or if there's problems, mechanic problems that they found. So we usually take that time to meet with each other, just talk, usually have a cup of coffee, get our morning rolling. And then after that, we go out to the ambulance and we start checking everything out. So we go through a whole rig check is what we call it. We log ourselves on. We also check all our equipment, so that's our monitor. We look at all our vent system, our IV pump, all our bags that we take with us on calls, as well as our supply cabinets. So make sure everything's either stock full or what we need to resupply on. And we always turn our ambulance on, usually get a quick look at what our gas is at, and then also run our lights and our sirens, so that way we know if everything's working as it properly should be. And then after that, the time is really ours to do whatever we need to do. So, either that's a morning call, or if we don't get a call, we'll go have breakfast either with other crews or at the station, have some coffee. Caffeine's a really big deal, obviously, working in this industry. You get tired pretty quickly, so we'll get some caffeine going, get some food in our system, usually run a couple calls. We meet with a supervisor at least once a shift, so that way we can kind of touch base with them and they can see, is there anything that we need from them, or if we just wanted to sit and talk. And then at that point, after we run calls, we usually write our charts. So we'll sit down, we'll write our charts. Usually it doesn't take too long, about an hour at that. And then, obviously depending on how many charts we have, it can take longer. So the typical day is pretty easy. It just depends on how many calls on average we're running. So usually wherever I'm stationed at, it's around 10 to 12 calls a shift. So it averages out pretty evenly. Usually have enough time to be at the station for at least an hour to finish the chart, maybe, take some downtime, eat, watch some TV, work out, take a nap. Napping is huge, highly recommend, love some naps. And then usually come the evening time, it's time to wind down. We'll usually eat dinner, and then, the rest of the night is ours, depending on if we get a call or not. So, in a 24-hour shift, it's you try to live it as if you were at home, per se. But also you have to keep in mind that you are at work and that a call can go out at any moment. So, I usually go to work, I'll usually study, sometimes I'll work out depending on just the kind of time we have. And then I love to take naps at work and I love to watch some TV. So it's good bonding time also with the people that you work with. So with the agency that I work with, we work around 56 and a half hours a week is what it averages out to. However, I like to tell people we work 72 hours in 5 days. So we'll work 24 hours on, 24 hours off, 24 hours on, 24 hours off, 24 hours on, and then you get 4 days off. So it's about a 9-day cycle, and you repeat it, obviously. So the days that we work switches up every cycle, and that's kind of just how it works. It's a lot of hours ultimately, but those 4 days that you have off really helps kind of bring you back to earth a little bit, get you squared out, and then you kind of go back for more. So it's a lot. It's a lot of time to be away from family and friends and pets, but you kind of, there's a payoff to it when you get those days off in between, and then also those 4 days off after your 5 days. So it's not the worst schedule in the world. Yeah, so I was working out of a station and we responded to a pedestrian versus vehicle. It was around 11 p.m. at night. Turns out this young lady had jumped out the back of a pickup truck that she was riding in. She was under the influence, and unfortunately, another car that was heading the same direction that she was, as she jumped out, she was hit by that vehicle. And so it turned into a pretty severe trauma, unfortunately. We did take her into the hospital, and while we were there, I was able to watch the trauma doctor, the trauma surgeon on scene in the trauma bay be able to perform a open chest thoracotomy, which is something that I had never seen before. And it was really in that moment that I realized this is definitely something that is a career that I really, really enjoy. I love traumas. I love critical calls. And being able to see something like that, sometimes our job really kind of ends when we drop a patient off at the ER. And so when we have those moments that we get to see the continuance of care in the ER, it gives us some closure with our patients, and also is a big teaching moment for us. So I know for me personally, when we get to drop patients off in the ER and I get to see how their care continues after I leave them there, that means a lot to me. I get a lot out of that. And also just it gives you a lot of hindsight of maybe things you could have done better, or what to look for next time. And so that was kind of a big moment for me, just being able to witness that, like, wow, okay, like this is really something that goes beyond what I do out in the field. Our ultimate job is to be able to stabilize them enough to get them to the ER. And so, knowing that we had done everything in our care to get her there and get her to that next step, where they were able to restart her heart with some intracardial epi and massaging the heart, which is something I had never seen before, was just a really eye-opening moment. And it really kind of, like I said, puts everything in hindsight of, what it is that we get to do out in the field, and how that gets to continue just beyond our ambulance. So during my freshman year of orientation at Boise State, you meet with a bunch of students that are in the similar boat as you. So my overarching goal was, to go the pre-med route. So I met with a bunch of pre-med students, both freshmen and then those that were seniors. And we basically just had the chance to ask them questions and get some feedback on, their experience as a pre-med student at the university, and then also, tips and tricks on, how to put yourself out there and what kind of experience medical schools are looking for. So I knew that I needed some sort of hands-on patient experience, and I knew that, there were a couple options with that. There was either to go the CNA route, scribe route, or, EMT route, and there's a couple others. But I heard the word EMT, and it was kind of like a light bulb kind of turned on in my head, and I was like, oh, wait, that's a great idea. And at that point, I actually didn't know anyone that worked as an EMT. No one in my family is like a first responder in that regard. So I did some research. I found out really kind of what the scope of an EMT is, and I realized that was more of my alley. I wanted to be doing something that was going to give me, kind of a different work schedule. And, the best part of my job is that I never know what I'm walking into on a day-to-day basis. And that could also be the worst part. But for me, it's exciting. It gives you a variety of calls. You work with a variety of patients, a variety of healthcare workers. And so I knew kind of immediately, as soon as I heard the word EMT, I was like, yeah, that's what I want to do. And as soon as I went into EMT school, it was kind of a done deal. I knew that this was kind of the career path that was going to get me to that next step. So I I started off in EMT school. That was about my freshman year of college. That was about a 3-month process. Literally within the first week of me being in EMT school, I was like, all right, what do I need to do to get to the next step? And the next step was going the advanced route. So as soon as my EMT school finished, I immediately took the advanced EMT school. And that kind of propelled me into the next step in my career. So that was about I want to say 5-month process to get through the advanced. And then after that, I passed the National Registry. And I was looking for a job. At that time I worked in retail. I knew I didn't want to stay there. I wanted to get a job working in healthcare. And thankfully, just, kind of how things worked out is the doctor that I kind of had been working with for most of my life was looking for a current medical assistant. Hers was leaving to go to PA school, and so she kind of brought the idea to me of maybe getting some experience working for her as an MA. And so I did that for about a little over a year, and kind of on a whim saw that the agency I currently work for was opening their applications, and I had no EMS experience up to that point. I knew that I really wanted to end up in EMS, but I didn't know if I was going to necessarily fit the bill, so I figured I'd apply anyway. And I did, and I was lucky enough to get the job, and I've been there now for just about 2.5 years. And it was pretty simple in terms of the application process. I was able to just send in my experience, my resume, and then you go through a couple different steps of both the practical tests that you have to take, and then also an oral test, and then a written test. So there's a bunch of different tests you kind of have to pass, and depending on how you do on those, they might offer you an interview. Thankfully, I did get an interview, and I think it was kind of during that interview that I was able to, shine a light on why it is that I wanted to go into EMS and why I specifically wanted to work with that agency. Because for me, I wanted to go the 911 route. I hadn't had any experience up to that point, but I knew that ultimately my goal was to work in 911 EMS. So luckily, they were able to kind of look at everything that I'd offered in my interview and my test, and I was fortunate enough to get the job. It's kind of interesting in EMT school. I remember, you learn about how you're going to go on all these calls, right? Like cardiac, chest pain and shortness of breath, and even code blues, right? Where someone stops breathing and their heart stops. And nowhere during my schooling did anyone ever really tell me flat out, you're going to go on calls and sometimes the patient's just not going to make it. And I think that was kind of like the biggest lesson I had to learn within literally the first month that I was working on the job. I responded to a couple different code blues. We had an adult code blue and we had a pediatric code blue, and unfortunately both of them did not make it. And it really wasn't until that moment that I realized, yeah, you're gonna go on these calls, and it could seem like a really the potential for a good outcome could be there. But, the reality is that, we can only do so much. And so I wish it had been more clear to me. I don't think it would have changed anything about where I'm at and what I do, but I wish it had been more clear to me during my schooling that, you're going to go on calls and not everyone is going to make it. And that's just kind of the reality of the job that we do. And it was kind of at that point that I was like, okay, yeah, this is real. This isn't school anymore. You're not taking scenarios out of a textbook anymore. You're really actually working with real people and real lives and real emotions, and yours included in that. And so I think that would have been really helpful for me to just be able to maybe understand that before I went into it, because I think I had such high hopes that you respond to these calls and you're gonna save someone. That's the ultimate goal, right? Which of course that is, but it just doesn't always work out that way. And understanding that that's not necessarily your fault as a provider. It's not really anyone's fault. It's just kind of how the way the world works. And I think that was probably my biggest lesson that I learned kind of coming into my role as an EMS provider. So kind of like I touched on already, the biggest thing working in a career like this as a first responder is that you are your emotions in your life is going to constantly be put to the test. And I think that something that I had to learn really quickly was knowing where my lines, where my boundaries were as a provider, and at what point, I could no longer, adequately serve my patients. And so you have to learn, where that line is for you, right? Because you're going to go on calls all the time, and ultimately, right, you have to, run that call no matter how good or bad it is, and get out there and work the next call. And so really learning how to know where your line is emotionally and physically in terms of the work that we do, that's going to be like the biggest thing that I think any advice I could give to someone is really kind of figuring that out early on, and having an outlet to talk to someone. I remember after we ran the first pediatric code I was on, the first month I was in this career, my supervisor pulled me aside and I had this, intense breakdown because I'd never seen literally anything like this in my life. I mean, this was beyond my scope of understanding. And so, she pulled me aside into her rig that she was in, and I just cried for probably like a good 5-10 minutes. And she's like, what do you need? What can I do for you? What can I give to you? And I think that in that moment, it was like, okay, what do I need as a person? Because I tell everyone, even my partners that I work with, if they're having a bad day, I'm like, okay, well, do you feel like if we ran that same call again, can you go back in the field and work that call again? Because that's the reality that we have, right? I mean, you could have a really bad call, and the reality is this, as soon as you clear that, you could get another call just as bad, if not worse. And so learning where your boundaries are as a provider and as a human is really important. And that's something that I've had to leave work before early, like on shift, because I ran a call and I was like, I can't be here anymore. Like I'm not in it mentally. And there's nothing wrong with that. And you have to emphasize that not only you have to advocate for yourself, but also for the patients that you ultimately have to serve, right? Because you can't give someone advice and tell someone to take care of themselves as a patient if you're not willing to do the same for yourself. And so that's my biggest kind of lesson that I've had to learn, is that I have to know when I need to call it and when, I can't be at work anymore. And unfortunately, that's tough. It's really hard. But it's a huge lesson about being honest with yourself and being honest with the people around you, because we've all been there. And you just have to know, when is when, and where is that line and where is that boundary for you. And I would say that's probably one of the most crucial things that I've probably gotten out of this job is knowing where I need to draw the line as a provider. My recommendation to anyone that wants to go into EMS is first and foremost, try to go somewhere and get a perspective on what it is that they do on a day-to-day, right? Because I can sit here and I can tell you about what I do, but actually seeing it and being a part of it, either as a volunteer, as a reserve, or just as a kind of a bystander where they let you watch, I think that's the biggest thing, right? You want to know what you're getting yourself into. And it's one thing, kind of like I've said, it's one thing to be sitting in a class and reading the textbook and talking through these scenarios, but it's a whole other thing to be in the situation of being that provider and being the one that responds to those calls. So my recommendation is always to find an agency where you can either get some experience and figure out if this is really something that you want to do. I think a lot of people go into EMS expecting that, it's going to be kind of sunshine and rainbows, and I wish I could say that it always is, but it's just not. And so, talking to people also that work in the field, whether it be as some sort of fire crew or, EMS, whatever it might be, just getting an understanding of the scope of practice and what it is that they do on a day-to-day basis really helps to understand what it is that you're getting yourself into. I think anyone who is passionate enough about taking care of people and serving their community can do this job. It's more about, are you going to be able to, put the sacrifices and the, sometimes the dedication that it takes to get through this job? Like, do you have the support system? those are the things that I really feel like people have to think about before they get into this. Because I think, having the passion for it is one thing, but you really have to look at the whole scope of things. You have to know what your limits are. You have to know, do you have family that can support you? Do you feel like this is the career for you? And the best way to do that is to really get some sort of hands-on experience prior to going into it, I would say. I love the people I work with. That would probably be the biggest thing that I love about the job that I work. I love everyone that I work with. I have no problems with anyone, which is, I don't think that's a thing that a lot of people can say about their jobs, but I feel lucky enough that everyone that I work with is someone that I have a unique relationship with. When you're working with people for 24 hours on end, you bond in a way that you probably won't with just other people outside of your job. And so the people I work with is probably one of the biggest things that has kept me tethered to the agency that I work with. And then on top of that, of course, right, like the community I serve. I love being able to work in the city that I also live in. It just feels like you're able to take care of the people that you live with, right? Like I live, kind of in a section of the city that I also work in, and being able to respond to calls to people that I've seen walking down the street or in the store before, and kind of having that recognition of like, oh hey, I know you, and they recognize me. It adds a different level of compassion and understanding to my provider care that I don't think you get anywhere else. And so I would say, the two biggest things that I love about my job are really just the people that I work with and the community I serve, because I feel very lucky to not only work with great people, but to also live in a community where I get to serve great people, especially when I'm out and about with my crews. And some people think it's really awkward when people from the community say, hey, thanks for what you do. But I personally love it. It's nice to get that recognition from individuals. And so, yeah, I feel pretty lucky to be able to work in this community with people. My ultimate goal is to be able to apply to medical school, which I will be doing in the next month, which is a lot to swallow, but it's very exciting. So yeah, becoming an EMT was really was my way of gaining patient experience, and also it's a valuable resource, as when you go to medical school or any type of graduate school, either becoming a PA or an NP, whatever that next step is for you, they really, really, really focus on what kind of experience you bring to the table. And so for me, I really wanted to be able to say that I have worked as a provider, and I have had, the different variety of calls that I've had, because they all teach you a lot. So ultimately, my goal is to become a doctor, and this was kind of my way of branching into the healthcare system. And I think the biggest thing is finding a career path that works for you. For me, it was EMT. It taught me a lot about myself. Obviously, I worked a little bit as a medical assistant. I learned as soon as I got this job that, my interests don't lie in a clinic. My interests kind of lie out in the field, or on calls that require a little bit more, or a little more critical and intense. And so I thrive off of that, and this is like the perfect subset of skills that I think is going to really propel me into that next step of my life of becoming a doctor. So this is kind of just the beginning. Go to IMA.